And I'm admitting one more person who's just joined us. And with that, I will go ahead and introduce our first speaker today, who is Lorraine Crim. Lorraine is a registered dietitian, nutritionist at Coconino County. Lorraine has also been involved with NAZADA for at least a year now. Lorraine, I lose track. She's a very valuable member of our group, and she's going to be starting us off by talking about important nutritional issues. So with that, Lorraine, go ahead.
Great, thank you. I somehow got disconnected from the internet and got kicked out on my own account. So I'm on Gabby's, that's why it has me as Gabby Short. But hopefully you can hear me okay. And yes, Candace, if you can help watch the chat, because I don't know if I can see it at all. But I do want to keep this very informal, so please ask questions. As Sandy said, my name is Lorraine Crim, and I'm work with Coconino County Senior Services. It's my pleasure to be here to talk to you today about nutrition and dementia. I have worked with a lot of patients with dementia, a lot of clients with dementia, and I also have a personal experience. My dad had early onset Alzheimer's dementia. And so this is a topic that's very near and dear to my heart. Dementia is really what got me interested in nutrition in the first place. So just a little bit about my background. I've mentioned that I've worked with Alzheimer's and dementia patients during my time as a dietitian. I've spent some time working at skilled nursing facilities and continuum care communities. And also currently, as of the last year and a half I've been working for Coconino County Senior Services. And so I take care of our senior nutrition program, as well as our transportation programs and our home care case management program. So enough about me. Today we're going to talk about nutrient needs with the older adult, and particularly the one who has Alzheimer's dementia. Hurdles to meeting those optimal nutrition guidelines. And we'll talk about identifying those hurdles and how to overcome them. Once I've covered those topics, then Sandy has some information that she'll share on swallowing. And then we'll have a cooking demonstration by Gabby. We'll be looking at making some fun foods that can be shared over the holidays, and they are some very dementia-friendly recipes. So I don't have a PowerPoint today. I wanted to leave lots of time for the cooking demonstration. And also, I want to keep this very informal. So if you do have a question, please feel free to interrupt. I think there's a raise hand function, but I'm not sure if I can see it. So feel free to stop me. So nutrient needs for older adults with dementia. So really, the nutrient needs for older adults with dementia are not at all very different from those older adults without dementia. Really, we're looking for a balanced diet, lots of water and fluids, something that resembles the dietary guidelines for Americans, and includes some exercise. So I'm not going to go into too many details about the dietary guidelines for Americans. I know many of us are already familiar with eating our whole grains and focusing on fruits and vegetables. But if you are interested in getting some more information on that part of things, you can go to choosemyplate.gov, and there's a great resource there. You could even put in your height and weight, your age, and it'll give you a printout of what it is that you should be eating. There are some concerns though during dementia. One of the things that can happen is dementia might not be the only disease that somebody is fighting. And I want to back up actually and ask, please everybody chime in. I'm not sure who the participants are that I'm talking to in this group. Are you mostly caregivers, or are you Alzheimer's patients? Do we know that information?
I know 2 people on here are professionals,
Okay.
at least.
And I can say, Lorraine, that there are 2 people on the call today who are caregivers that I know.
Okay. So mostly caregivers and professionals. Okay. So one of the things that happens is a lot of times those that have dementia might also be fighting off other diseases, or maybe they have other chronic comorbidities such as diabetes or cardiovascular disease or chronic kidney disease. It could be end-stage renal disease. Those are things that would affect the amount of protein. For example, chronic kidney disease at stages 3 and 4, you might need to limit protein, but at stage 5, they need extra protein. So those are some things that could affect nutrient needs during the course of dementia. Also, drug nutrient interactions. For example, these can alter needs. For example, somebody's on Lasix, it increases their potassium requirement. Or somebody taking a diabetes drug might end up with a side effect of altered taste. So those are some things that could affect nutrient needs. So our goal with nutrition and dementia is not to cure the dementia. We're not going to be able to do that. What our goal is to prevent weight loss and preserve lean body mass. By doing this, we help keep the immune system strong, so that if any infection comes along, the person is able to be in the best position to fight it off. It also helps prevent pressure ulcers if they have limited mobility. So we do know that when we see weight loss, unplanned weight loss and loss of lean body mass, we do see increased morbidity and a decreased quality of life. So we want to prevent that. So one of the things that is important, and I'll talk more about this a little bit later, is monitoring weight and just watching for changes in eating habits. Okay, so let's talk about some of the hurdles to optimal nutrition. Before I get into this section, does anybody have any questions? Okay. So I mentioned already comorbidities and drug nutrient interactions. So one of the things that is different with dementia versus an older adult without dementia because we have that element of confusion. This is what where regular eating times can really come in handy. Establishing a routine. Sitting down together at regular meal times in a pleasant environment with familiar foods, and simple foods. This is where sometimes finger foods come in handy, and we'll talk, some of Gabby's demonstration has to do with finger foods, so you get to see some examples there. And then simple reminders to eat and drink. It might sound silly that we wouldn't need to make reminders for that, but even sitting down at the table together, an Alzheimer's or dementia patient can forget why they're there at the table. So it's a good idea to remind to take a bite every so often. Take a sip of water in between. See. In addition to the memory aspect of things, there are some physiological changes that occur as we get older that would be occurring and coinciding with dementia. So one of the things, and many of us are already aware of this, our metabolisms slow down as we age. And this can affect the amount of lean body mass that we have, because our lean body mass is metabolically active, and as we age and the metabolism slows down, it's not uncommon for us to start losing lean body mass as the years go by. Another change that occurs, there's hormonal changes that happen that affect metabolism, as well as we have a decreased production in melatonin as we age. And melatonin, many of you are probably already familiar with it as a hormone that helps us regulate our sleep cycles. And so if the sleep cycle is disrupted and our dementia patient is tired during the day at mealtime, that can affect how they eat. As we age, our taste and our smell change. They decrease. And so that could affect the things that we like to eat. Our vision and our hearing decline as we age. We are very social when it comes to food. And so if it can become difficult for people when they are not able to hear, to sit down and at a table and have a meal together. Vision can also affect things. People can get embarrassed even with when they have vision problems. I know I've seen people get embarrassed over not being able to tell whether or not they're spilling food when they're eating. It can also be difficult for them to find the food on their plate. As we age, our hands can get weaker and we can have difficulty holding utensils. And this is another area where the finger foods may come in handy. We also have a decreased thirst sensation. So I mentioned earlier needing reminders. Well, on top of that, as we age, we don't have that strong sense of thirst until we're usually partially dehydrated. And so it's a good idea to maintain regular schedule for making sure that our those that we are taking care of regularly drink water. Decreased saliva production can cause dry mouth. So that it can be important to include those meals with or those drinks with your meals, so that after a bite of food is taken, that we can have that additional moisture. Also, including sauces or gravies might make it taste better, in addition to making it easier to deal with the dry mouth. Depression, of course, can occur and make it difficult to, will cause a loss of appetite as kind of a symptom of depression. Also, as we age, our teeth age as well, and sometimes that means cavities or losing teeth or needing dentures that don't always fit well. So it can be a challenge with chewing. And then, of course, swallowing is also a problem, and I will let Sandy talk about that more here in a bit. So I just listed a whole bunch of things that can go wrong. And it might sound sad and depressing, but and it is a very sad and awful disease. But I'm here to tell you that these problems don't have to be a problem. Because if you can identify them, there are solutions for every one of these problems. And, you know, when I worked in skilled nursing, this was really one of the most rewarding aspects of my job, is to be able to figure out when I identified somebody having a problem nutritionally, and we didn't know why. And you're not always going to know why right off the bat. And, you know, one of the natures of the dementia is that they're oftentimes not able to communicate to you what it is that's wrong, what they're experiencing, what they're feeling. But that's where you as a caregiver or other professional can step in and kind of play detective and figure out what it is that's going wrong and how it can be solved. So you first want to start out with identifying the problem. So I talked before about weight loss and monitoring that. If we see a significant amount of weight being lost all of a sudden, that's a sign that they're not getting enough to eat, they're not getting adequate nutrition, something is wrong. And then you also, even before you see weight loss, sometimes you can see a change in eating habits. Is somebody all of a sudden just sitting there at the table, maybe not taking as many bites as usual? They say, you know, sometimes I'll see a lack of appetite even presented as, well, I don't really like this. I don't really feel like eating today. I don't know. I'm not that hungry. I've never liked this type of food. So it's interesting. I can tell you, I once had a patient who loved the food, just absolutely loved the food. And one day, all of a sudden, it was like night and day. All of a sudden, I hate the food. The food here is awful. I can't stand it. And I went back and I found out like a few days beforehand, this person was started on a new heart medication. I brought it to the doctor and the doctor said, well, they need a heart medication, but we can try switching it to a different type. And so he switched the medication, and the next day after he switched the medication, all of a sudden it's, I love this food. Oh, it's great. And so this person went from eating 100% to having this new medication and eating almost nothing to back to eating 100%. And all based on a medication, and not really knowing and not really being able to communicate that. But I was able to play detective and figure it out and solve it. So those are kind of some of the things, you know, you can look out for. So let's go back and think about some of the other topics that I had brought up as potential problems or hurdles. And let's see if you can chime in here, please, and see if you can guess what some of the things you might look for. So I mentioned melatonin and that interrupting the sleep cycle. So if that's the cause of somebody not eating, what do you think you might see? What might the patient be doing differently? Does anybody have any ideas? So you might see this person falling asleep at the table, particularly in the morning. If somebody's not sleeping well at night, you get them up for breakfast and they might just be really tired and fall asleep. And if you're falling asleep, you're not going to be eating. And so that one you can bring to your patient's doctor or your loved one's doctor and present to them, you know, this is what I'm seeing with their sleeping. Sometimes they can get them on a sleep aid, or you can also make sure that you're not giving them coffee throughout the day or anything that might keep them up. If they really like coffee, you can switch them to decaf. Let's see. Also, making sure that they're sleeping at the appropriate time can really help with that problem. Okay, so decreased taste and smell. What might you see with that one?
Them not eating their foods?
Them not eating their foods, they might just stop eating it. They might just, you know, not be into what's being served. And I have also observed that I see a lot of, I've seen a lot of my dementia patients go more toward sweets, wanting sweets being more appealing than anything, which can be a difficult thing to deal with, especially when you have a patient who might be diabetic also. And really, it's the position that has been taken by the Academy of Nutrition and Dietetics that we're not going to restrict diets in somebody with dementia, because you really, you know, you tell them they can't have things that taste sweet, they might not eat at all. And I've had patients where they've just 100% lost interest in food. This happens toward the end of the course of the disease a lot of times, that they just lose interest in eating. But the sweet taste of something like a glucerna, they actually very much enjoy or an Ensure. And I've seen people live for a good couple of years just drinking that and enjoying the sweet taste of it. So decreased saliva. You might also see a similar situation where they just stop eating. They might be able to tell you that they have dry mouth, or they might look uncomfortable when they put something in their mouth. So it's a good idea to watch for these things. Also, dentition, that can be one of the more obvious things, but they might not tell you also. It can be hard to know sometimes if their dentures are bothering them. So it's something you really do have to look at. But I'll stop there and I'll turn it over to Sandy so that she can talk to us about the swallowing problems that can occur and how you navigate that.
Okay, thank you, Lorraine. As many of you know, I am a speech pathologist, and part of my professional responsibilities have to do with evaluating and treating people who have actual swallowing problems. And there's many, many different reasons why someone might have swallowing problems, and Lorraine has actually touched on a few of sort of the easier and more common issues: poor fitting dentures, mouth pain, dry mouth, and those kinds of things. But what I wanted to say first is that swallowing function, the function of swallowing, kind of like breathing and walking and all of those things, is ultimately controlled by the brain. And so any disorder or any changes that are happening in the brain may cause difficulty with eating and swallowing. And the reason I say eating and swallowing is because I sort of separate those two things. But of course, as we know, when we eat, we're using all of these different skills. Eating, to me, is getting the food from the plate to the mouth. Swallowing starts with, once the food is in the mouth, going down the throat, through the esophagus, and into the stomach. Okay. And so depending on the type of dementia someone has, how long they've had the dementia, where in the course of the progression they are, different issues may crop up with either eating or swallowing. Some of those may be due more to confusion. Some of those may actually be due to neurological changes that are changing the sort of reflexes that happen once the food is in the mouth, goes through the throat, and down further. So that's one reason why it's not really possible to say, well, this one thing is what's going to affect everyone, because there are different types of dementia, different trajectories, and of course, then individual differences. You know, we are all individuals, and that has a lot to do with this. I'm going to highlight a couple of sort of general things, as Lorraine did, to just sort of watch out for that may become problematic. One thing is that memory problems that people have, and another issue that some people have, which we call disinhibition. Inhibition is to inhibit your responses. Disinhibition is no control, and this person will react to any kind of thought that they may have. Either of those issues, either problems with memory or this disinhibition, can cause overeating. My grandfather had dementia, and the family was noticing he was putting on a lot of weight. And when somebody finally spent some time with him in his home, realized that he would get up in the morning, he would cook breakfast, he would sit down, he would get up an hour later, he would fix breakfast all over again. And breakfast was eggs and bacon and toast and all of that. And so overeating can sometimes be just as much of an issue as not eating enough. I'd like to talk about utensils for just a minute. As Lorraine said, yes, because of arthritis or other kinds of sensory issues that people may have, it may just become harder for them to hold and use a fork, a knife, a spoon, and that sort of thing. But with dementia, particularly as the disease progresses, people actually may have more difficulty utilizing those utensils in the way that they always did, and that the way that is correct. So what happens is the person now becomes confused. How do I hold the fork? Which way do I hold it? And how am I supposed to coordinate a fork and a knife at the same time? And so if you see that your loved one is starting to have trouble using utensils, the first thing to do is just to figure out which one utensil is the most appropriate for that particular food that they're eating, and get rid of all the extra utensils. Sometimes people find that using a spoon is actually easier than a fork. And so that's just something to keep in mind. Another issue that has really nothing to do with motor issues and confusion in the way that I've talked about it are distractions. One of the things we know with someone who has dementia, and this can even happen very early on, is that the person is very prone to easily being distracted. And so if they're eating, but the TV is on, there may be kids in the house running around, a workman there doing something, somebody else is talking on the phone while they're eating, they're not able to focus their attention on eating. They get distracted by what's going on around them, and therefore they're going to be more interested in that and not eating. So trying to keep distractions to a minimum, focus on the eating. Lorraine talked about fatigue. Absolutely true. Fatigue can be a real issue. And sometimes what I find with people is that if they get tired very easily, and this often has to do with other medical issues that might be going on, instead of trying to eat 3 bigger meals a day, small snacks, just about every hour and a half or 2 hours throughout the day is a nice way to be able to get the nutrition and hydration into the person without expecting them to finish that big plate of food. Couple of tips about more foods themselves. This is sort of a no-brainer, but believe me, it sometimes just needs to be said, and we need to think about it. Softer foods are easier to chew and swallow. And so if somebody has dental issues, if they're later in the disease process, they may actually start to have more trouble chewing. And so dry, crumbly, dry meats, tough things just become too hard for them to eat. And they're trying to then swallow a whole piece of meat, for instance, which is not a good thing. Again, along those same lines, make food moist, gravies, sauces, condiments. As you know, if you've ever had a bit of a dry mouth and you try to eat a dry cracker, it's really hard to do anything with that cracker in your mouth. That's the kind of thing I'm talking about. It's much easier to use dips or whatever is appropriate for that food within dietary restrictions. Smooth, soft, nice and easy, that's going to go down well. One mention, good oral care, brushing teeth, flossing, all of that I know can oftentimes be a fight with someone with dementia, but as much as you can have that happen, that's really helpful. Because if you keep the mouth clean, it's good for maintaining those teeth that the person does have, also preventing other kinds of infections that might crop up. Another thing I'm going to go back to that Lorraine mentioned, and I think this will probably be my last comment, is that when a person has dementia, we can often find ourselves in these battles. You know, you need to drink more, you need to do this, you need to do that, drink this, eat that, drink this, eat that. It's much better if instead of trying to cue the person that way, we eat and drink with them. So it's much better to say something like, let's have a snack. It's time for a coffee break. Gosh, I'm thirsty. Let's sit down for a minute and get something to drink. Because then you're putting it more on yourself. It's not their problem that they have to do something about. And again, you're using that socialization. We're taking this time together to sit down and enjoy a snack, or enjoy a cup of coffee or an orange juice or whatever it happens to be. And truly the last thing I will say is that if you notice that your loved one is truly having real trouble swallowing, and that can be just they keep the food in their mouth for a long time, they're coughing when they eat, they probably don't, hopefully, but can actually have an actual choking incident where the food gets stuck. anything like that that seems to happen more than just out of the blue, talk to your doctor about it, because somebody like me, as a speech pathologist, should be called in to evaluate what's going on and then figure out what needs to be done for your person. And so with that, I will take just one quick minute to see if there are any questions about anything Lorraine or I had to say. And again, you can unmute yourself, or you can put a question in the chat, and I'll just give a few seconds for people to do that if you have a question. Okay, I don't see any questions now. Again, we will have more of a Q&A at the end. And so now I am going to introduce Gabby Short, who works with Lorraine at Coconino County. And Gabby is the Senior Nutrition Program Supervisor. And what she is going to do for us today is a cooking demonstration of, as Lorraine said, dementia-friendly foods. And as they're getting that set up, I will just let you know that when we talk about finger foods, we're not talking about chewing on your fingers. What we're talking about is foods that you can eat with your fingers, foods that you can eat that do not require utensils. And as we've said, sometimes when utensils become difficult to use for whatever reason, finger foods are really helpful. And that can be hot dogs and sandwiches and all of those kinds of things. But I think Gabby has some really interesting and yummy ideas for us for other kinds of things that we can consider finger foods. And so with that, Gabby, are you ready?
She is ready.
All right, I will turn it over to you.
Okay. Hi, everyone. My name is Gabby Short. I just want to thank you so much for giving me this opportunity to work with you and showing you these wonderful Alzheimer's friendly recipes. So a little bit about myself. I actually help take care of my great grandmother, who is 96 years old, and she does have Alzheimer's. She has a more severe Alzheimer's, so I definitely can relate to the caregiving portion as well as the food portion, and even a little bit of what Lorraine talked about with the nutrition, you know, even the dysphagia portions, just seeing a little bit of everything. So these recipes really would have been beneficial for my grandmother, so it's really good to know them later on. So we do have 3 different recipes. So our first one right here in the main, we have some wonderful meatballs. We have a nice little yogurt herb sauce. And right over here, we have sweet potato wedges, a little bit like a French fry for you, but healthier because they're sweet potatoes and they're delicious. Lorraine is going to help me with them. So we're going to go ahead and start with our meatball recipe, which is in the middle. If you like, we can send these out to you later, but let me just go ahead and tell you a little bit about what's going on here, all right? So we have a 16-ounce ground turkey. We have 1 bean egg, some breadcrumbs, chopped onions, parsley, black pepper, and some allspice, and some milk. So that's what we're going for here. So we're going to go ahead and get this started. So Lorraine, if you want to come on and help, and we'll get going. So we already have our oven preheated to 450, so we're good there. So what we're going to start with is in our large bowl. Yes, please. We already have our turkey in here just to kind of save. You also have gloves if you like. We also did wash our hands, so we're good on there, but we also have gloves if needed. You know, with this recipe is actually really great. So again, relating it back to my Nana, for example, when my family did like hamburgers, for example, she would used to tear them apart, and she wouldn't really, yeah, all of it, yep. She would just like deconstruct her hamburgers or sandwich or anything that we were giving her. So if we were to give her a meatball, it'd be a little bit of a sized portion, and it'd be easier for her to just use her fingers and eat with the finger foods. Not only that, but it would just been less stress and less anxiety for her, because she used to get very overwhelmed by trying to figure out how to, you know, eat a sandwich or her hamburger. So having something simple as this little meatball is perfect, because they can just hand to mouth, little hand coordinations. Thank you. Get this going. If you have any questions, go ahead and please ask, or if you have any cooking tips or anything like that that you like to do, you know, with your patients, your family, please go ahead and share it with everybody else. Another great benefit for this meatball recipe, for my grandmother, she was very hands-on the kitchen. She also used to love to make tortillas. So sometimes, well, now she's not as active in the kitchen, but before that, she used to be really hands-on. So when she would come in and help, my mom and I would be the main ones who were to cooking. But sometimes we would give her little things like helping us roll, you know, anything out, like tortillas. So even like a meatballs would be a great way to incorporate them, because that memory from a long time ago, you know, kind of kicks in. So for example, my grandma, my nana, she used to make albondigas, which is a meatball soup. So again, she had that memory of how to roll things out because of the tortillas, the meatballs. So it really gets their memory going as well as their hands. So whenever you can, try to get them, you know, involved. It's a great thing.
That's a great point, Gabby, and that made me think about sundowning too. And you know, what a great activity to do, you know, right before dinner, where you might be making dinner anyway. Get them involved with the meal.
Definitely.
So this is how the meatballs go. And then whenever you want me to move somewhere else, let me know.
That's okay. If you want to keep, we're gonna have Lorraine keep doing the meatballs.
Okay.
We already do have some cooking in the oven, so you can kind of see a final product, which is great. But we're gonna go ahead and move on to our sweet potato wedges. So this is what the recipe looks like. Again, we have some sweet potatoes, some olive oil, rosemary, salt, and pepper. So just a little quick thing. This is another great way to get your family member or the one person you care for involved. You can get a nice little brush like this at the dollar store for $1, or anything if you have at home, and you can have them help wash off fruits, vegetables under nice warm hot water, depending on their temperatures of how they can handle the temp. So nice and washed. These are already washed, but it was just for a demonstration. So for the wedges, they're super easy. Again, your finger, your thumb, rock, and then you're going to cut in half. Kind of tough, so you have to give a little bit. You're going to cut in half. You're going to cut one more time down the middle. And now from here, you're going to cut one more time to create a wedge shape. Again, you can cut them however you would prefer. A little bit skinnier, a little bit bigger, whatever you think works best for yourself as well as the person you're taking care of. You know, and the best thing about cooking is if you know they don't like pepper, you can always trade it out for a different type of spice that you know they love and enjoy. So that's the best thing about cooking. I'm gonna go ahead and put these here. And I'm also protecting my fingers by doing a claw. Cutting it down. Beautiful. So they're nice and long. And again, if these are too long, you can always cut them in half. A little bit faster here for you. Another great thing with this recipe as well is you can always get them involved in either stirring, mixing things, you know, making sure they're using their hands. Now, let's say your loved one or the person you're taking care of doesn't like to get the oil mixture on their hands, or it could be anything that you're cooking with. A great alternative that you can do to get them involved in the kitchen is using like a gallon-sized baggie. And instead of using a bowl, you can always put the wedges in a gallon-sized baggie with the oil, salt, and pepper, and you can have them massage the bag and just pretend it's like a big fun game where they get to massage it, move it, be really interactive with it. So that's another great way if they don't like to have the oil on their hands.
What a great idea.
Thank you. Perfect. So now they're all nice and cut up. From here, we're just going to go ahead and put our olive oil, which is 1/3. You can always use less, of course. We're going to mix them around so they're nice and covered. Again, if they didn't want to use the spatula or a bowl in this case, you can always put it in the baggie like we discussed earlier. Or simple little things where you already have things pre-measured, you can always have them help you dump it in. And definitely be prepared. Keep going. Awesome. So it kind of looks like a good toss mixture. I'm going to just go ahead and use my hands. Another important thing when you are cooking for any elderly population is making sure that you're not cross-contaminating. So again, that is displayed with our 3 different boards and how everything has its own equipment. So we're not, having the turkey cross-contaminate with our little wedges. All of our hands are nicely cleaned. The elderly population is really, at high risk for foodborne illnesses. And something with this one, we kind of want to lay them on our back. The skin side down. There we go. Ta-da. Perfect. And then we can throw those in the oven. Thank you, Bernie. Does anybody have any questions or anything they would like to add so far? If so, please shout it out. It's totally perfect.
You want me to take out the other one?
Yes, please. All right. I'll be attending. Awesome. Okay. So Lorraine is going to go ahead and pull out our meatballs and the sweet potato fries that we kind of already prepared for you, so you can kind of see a great visual at the end. I know earlier it was discussed how sometimes taste changes as we get older, and sometimes it's a little bit harder on these individuals. So sometimes some people would love a great barbecue sauce to dip their meatballs in. I can lay them down so you don't have to hold on to them. Thank you. So we have like a perfect, barbecue sauce. If they don't like barbecue sauce because it's either too sweet, maybe even a little bit salty, depending on their taste. Another great alternative that I actually received from Lorraine is our yogurt herb sauce. This sauce is a little bit softer on the taste buds and, not salty at all. And it just goes really well, and it's not sour. With my grandmother, for example, she did not like ketchup. She did not like barbecue sauce. So we know that was like served with her. She was not happy. So something maybe like a herb sauce would have been a better alternative for her. Anything to add on the herb sauce, please?
No, I think, it's nice for people to have options.
Yes, indeed.
What works for one might not work for the other.
Perfect. I agree. Awesome. Okay, So we're gonna go ahead and start our yogurt herb sauce. So what it is we have 1 cup of plain yogurt. We're gonna mint some fresh cilantro, fresh mint. We also have 1 clove of garlic to mint, as well as salt and pepper for you today. We're gonna go ahead and get that going. Sure, I think I'm gonna move it. Awesome. And if you would like, you can dump that in. Another great trick that I've learned too in school is if you
How
put,
nice.
right, I know.
It just comes right out.
Yeah, if you put saran wrap of some sort inside the cup and push it all the way down, it's a little bit easier to clean, and it's not that big of a mess, and it's dumped right in. So that's pretty
Very
nice.
cool.
So there's that one for you. We do have salt and pepper, so we're gonna do that for a taste. We have 1 clove of garlic, so we're gonna go ahead and, oh, this is interesting. And get that chopped up and mixed. With this sauce, it does say to try to have it melt the flavors for about 30 minutes so it really sets in. It does last up for 2 days, which is pretty nice. We'll just do 2 of them. And you probably want them a little bit smaller. And for mint and cilantro, so for mint,
It smells good.
right?
Already, even through the mask.
I know, huh? So a little bit with the mint. You can always peel it off the stem. You can layer it on top of each other. It's called chiffonade. We'll get some going here. And what I'm going to do is I'm going to go ahead and roll them up. And again, if you prefer to do your mint in a different way, you're more than welcome to. So it's nice. It looks like a little burrito. Cute. And then you're just going to protect your fingers.
Beautiful.
Might have to help break it up a little bit because I think I did them too
Looks great.
many. All right, and same thing with the cilantro. Again, if you'd like, you can add the stems, but sometimes it's just a little bit easier not to. Is there anything else that you would like to add with cooking?
Well, I'm going to grab these sweet potatoes so that they can be sweet. Don't they look wonderful? And I think, you know, the sweet potatoes and the meatballs, both of them would be great with either barbecue sauce or the yogurt dipping sauce. Lots of nice options there.
Indeed, and this is the final product of the yogurt sauce. And again, you can always add more to your taste.
More or less herbs or pepper or salt, whatever you like.
Indeed.
Easily customizable.
Yes.
Right, well, that's all we have for you today. Are there any questions?